Welcome back to Desk Careers, everybody. I'm so excited to bring another amazing guest. Today we're meeting with Dru Campbell, who is the head midwife and lactation consultant at Healthbay Polyclinic. Welcome, Dru.
Thank you very much for having me.
It's so exciting having you here. I'm really excited to bring midwifery and lactation consultancy because it's one of those professions that you don't really learn about. Students never really hear about, but then suddenly, you grow up and you have a family and they become the most important key people in your life at a time when you need them the most. It's a real specialist field that you only kind of come across when you're in that stage of life. So before we go any further, I think it's really important that we kind of bring it into context. What exactly is a head midwife, and what does it mean when you say lactation consultant?
Okay, so as the head midwife of Healthbay, we actually have a team of 6 midwives, and so I'm the lead midwife in the team. So my main role is to just make sure that the clinic runs smoothly. So we have a few different kind of services that we offer. We do antenatal care and education. So before women see the doctor, we do their screening and make sure that everything's okay. Education, we do antenatal classes and teach new parents, or parents-to-be, how to, get through and what their options are during labour and birth, and then also how to care for a baby afterwards. We have some parents who have never held a newborn baby before, so that's a really good practical way of learning. We use a doll and we change nappies and all those types of things. And then I would say that most of our work here in Healthbay and here in Dubai is postnatal care. So we give a lot of advice with new parents. We also weigh and measure babies. We give vaccinations, and we actually see babies from birth up until 18 months of age. So it's quite a wide variety along the spectrum of pregnancy, but also afterwards is where we really come into the fore. My role here is also, I do quite a lot of PR work and also marketing. I don't have a marketing background at all, so of course I'm constantly messaging our marketing manager saying, have I put this right on Instagram? And then she says, oh my gosh, Dru, change the picture or the video. You need to bring it back a bit. But in all seriousness, I do try and market us because we are a unique team in Dubai. As far as I know, we're the only team in the community that is providing midwifery care. Also, the lactation side of things, to become a lactation consultant, you need to have at least 1,500 hours of breastfeeding advice and help. So you need to be helping women with breastfeeding, and it's a 4-hour exam to pass the test. So it's quite a stringent test, but it's a worldwide qualification. It's the gold standard of lactation. So if we have patients or families who come in and they're having struggles with breastfeeding, then obviously we can step in and help them with specialist care.
Wow.
So yeah, that's my role in a nutshell. But it keeps me very busy.
It does. It sounds really exciting too. And I mean, we're going to get into, I want to ask you so many more questions about the actual things that you do and what you need to prepare to do something like this. But before we get into that, when did you know this was what you wanted to do?
That's a really good question. You can tell from my accent that I'm Australian. And when I was going through high school, we go to year 12 in Australia. And it got to about year 11, so I guess that's kind of A-level kind of time. And we had to start figuring out our subjects. And I thought, I had no idea what I wanted to do, absolutely no idea. But I knew that I wanted to help people. So, and my mum's a nurse, and I thought actually I could probably do nursing. So at that time we were doing work experience. So, of course, I go into the hospital where my mum is working. She worked in theatre at the time, and I was in A&E. And I think somebody came in for stitches or sutures, and I thought, oh my gosh, I can't do this. I can't. There's no way I can look at these things. And I felt like I was going to faint, and I thought, right, that's not it. But then, I thought, okay, I've got to give it another go, and so that's how I kind of got into nursing itself. So I did a Bachelor of Nursing. That was for 3 years. And during that training, I saw a birth. I was lucky enough to be working on a maternity unit as a student nurse. And I saw a woman have a baby, and it was her 5th baby. Can you believe it? She was having her 5th child. And it was the most amazing experience I think I've ever seen. I was just in total awe of this woman and how she gave birth. To me, it looked like she did it easy. Of course, it wasn't at all. It's a challenge for sure. But that's when I thought, right, that's what I want to do. So, having that kind of that input and having that visual of a woman giving birth, that's put me in the right path. But it was difficult in Australia at the time. I want to show my age too much, but it was many, many years ago. At that time, it was quite difficult to get onto a midwifery course. And so I worked as a nurse for 6 years. I worked on, urology, gynecology. I really, really had that experience, which was great. And then I went into midwifery. So, and 20 years later, I'm still here. So I obviously made the right choice.
Incredible. What you mentioned about your mom being a nurse, doing work experience, and then, finding midwifery on that journey is exactly the kinds of things that we talk about when we're helping the youth. Most of the time, students are exposed to careers based on their parents and their inner circle of careers, which is exactly what you said. But then also, it doesn't necessarily mean that you'll want to be doing those things. The work experience gives you an insight into whether you can see yourself and if they are things that you want to be doing. Now, you said that you did a Bachelor of Nursing. Does a young person need to do a bachelor? Like, do they need to be a qualified nurse to become a midwife, or is there another pathway into midwifery?
Yeah, so now, in certain countries, you do need to have a nursing background to then go into midwifery. However, most countries around the world now, particularly the UK, Australia, I'm not sure about America or Canada, but I know for sure UK and Australia, you can do a direct entry midwifery course. So in fact, 4 of our midwives here at Healthbay are direct entry midwives. So they went straight into a Bachelor of Midwifery. And there's some thought, okay, it would be amazing to have the nursing experience to go into midwifery, and I'm really glad I had that nursing experience because I really consolidated the kind of nursing care that I needed. However, our midwives and all the midwives that I've ever worked with who are direct entry are equally as knowledgeable. Obviously, you're learning all the skills that you need to become a midwife. So, yeah, not necessarily. You can go straight into midwifery. In fact, one of our midwives studies something completely different. I can't remember exactly what she studied. I've got a feeling it was economics or something similar. And she decided that it wasn't for her, and then went straight into midwifery, and now she's a qualified midwife. So, it doesn't have to be nursing first and then midwifery.
And would the pay scale be the same for a midwife who didn't do nursing and a midwife who did nursing?
Yeah, it's the same pay scale.
It would be the same pay scale. Would
Absolutely.
you say that midwifery, is a gender-dominated career, or is it kind of gender neutral?
No, definitely gender dominated with women. Now, midwife actually means with woman. So men can be midwives, and in fact, my course in Australia, my midwifery course, we actually had 3 men on the course, which was great because I love working with male nurses and I love working with male midwives because I don't know, they just put a calmness in the unit generally. And they were doing their midwifery because they were working in A&E departments, so they're working in accident and emergency departments in the country areas. So they wanted to have the midwifery behind them so that then they could obviously, help women give birth if they came in. So, but definitely gender dominated. So, a lot of them used to get asked, oh, well, how can you be a midwife when you're a man? And, they always said, well, it's, you can have male doctors too. You can have male obstetricians or male gynecologists. So it's the same kind of thing. So, yeah, definitely, female dominated.
Very interesting to see how the stigma around our perception of what gender should take on a career really has an impact on that career as well. Because I know we talk very often, we put a lot of focus on females in STEM and trying to encourage more young girls going into science-based careers, but we don't really focus very much attention on the flip side of men in heavily female dominated careers. So it's always interesting to bring this perspective in. Now, I know we have young students across the college and probably careers practitioners watching this in schools around the world, with young people saying, I want to be a doctor. I want to go into medicine. I want to be a doctor. What would you say are some of the benefits of being a nurse and now being a midwife that young people should be more aware of so that they can broaden their scope of careers in the health practice?
Yeah, I mean, I think for me, and my belief is that if you find something that you're passionate about, you're going to be working a lot of hours, a lot of your life, particularly if you're working full time, you're going to be putting a lot of hours in. You want to make sure that it's something that you're passionate about, and that you want to get up every day and go to work. I mean, I actually really love my job, but I love helping people, and that's my passion. So, I think broadening your scope is really important, because maybe, and when I was younger, I did want to go into medicine. I looked into medicine. I probably maybe my exams, maybe I did well. I did very well, but maybe not enough to get into medicine. But that's not why. I actually believe it was meant to be that I did nursing. I believe it was meant to be because I was so passionate about it, and I know that it was the right choice. So I think it's important to find something that you are passionate about, and that would be my recommendation to students is, and then, kind of tiptoe into finding the career that you're looking at. And I know that's it's quite hard to it's going to be different for everybody. And, as we spoke about before, sometimes you might think you're going to go into one career and then it completely changes to another. But, then you've got the knowledge behind you, to maybe make those informed decisions. I hope I answered that question. Okay.
Yeah,
sorry.
no, that's absolutely great. That's great. So we're in thinking about your top tips, kind of moving forward on what you were just saying to young people about make sure that you do something that you're really interested in, that you're really passionate about, and then kind of find your way through it. What would you consider your other top tips for a young person to make sure that they are on the path that feels right for them and not the path that they think they should be on?
I think what I did when I was going through my nursing training is I did quite a lot of voluntary work. Now, I know it's difficult here in the UAE, to maybe find or be able to do voluntary work, but it is kind of out there if you can, it depends on the field, I know. But for example, what I did was I started volunteering. We had a service called Meals on Wheels, and we used to deliver, meals to older people. And, I started to develop communication skills with, different aged people, different, nationalities, different genders. And, that gave me quite a lot of experience. Then I managed to get a job as a carer. So I was looking after a quadriplegic man in the mornings and the afternoons. So, before I'd go to university, after. And when I went for a job, it was actually very competitive. After we finished our graduate programs were very, very, very hard to come by. So then I, that experience was on my CV. So I think if possible, it would be really great, or even to find a mentor. Maybe if you're looking at getting into a field, it might be worth kind of trying to get in contact with somebody who's an expert in their field. And I know that these interviews maybe help a little bit to put students in contact with other with people who can maybe mentor them, or maybe give them an idea of what their job involves, and maybe help out that way. But even things like the Duke of Edinburgh award, and things like that, I think do well with your CV. But actually for the career choice, I think mentoring or volunteering is a good way to get some experience as well, because it's all about experience, isn't it?
It really is. It really is about experience. And also it's about getting them to really be in touch with the realities of the job. I think sometimes
Absolutely.
young people have an idea of what they think it'll be, and they're not really sure about the day-to-day tasks, because that's not really what they're focusing on. So I want to go backwards, following up on this, those day-to-day tasks. You mentioned that the things that you do, for example, you talked about, looking at PR work, and you're also managing a team. So you're taking on tasks that were definitely not part of the degree that you studied. What would you say about that part of your job, that anyone thinking about going down this career and progressing in the career to becoming the head of the department should really be paying attention to, even when they're in secondary education?
Yeah, I think, the midwifery career as such, of course, I have the clinical experience behind me. So, I worked in Australia for a year, then I moved to the UK. I had to do an extra 6 months of training in the UK. Interestingly enough, I didn't get paid for that. I had to do that, work full time with no payment for 6 months. But I had my eye on that I really wanted to get registration in the UK. And then I worked on labour wards. I was looking after women in labour. I was working on antenatal, postnatal. So, I have that clinical experience behind me. During the Bachelor of Midwifery, because what I did was I then went and did a postgraduate. I had a certificate in midwifery from Australia, and then I did a postgraduate in the UK. We did a lot of leadership exercises, but I have to say I'm really glad I did that when I was here in Dubai, because felt like I could relate it to my job. So leadership skills, leading people, and communication skills is the most important aspects of leading a team. Obviously, we work within a multidisciplinary team, which means that we have, I work with doctors, I work with physiotherapists, I work with other midwives, I work with nurses, and, also our management team. I need to give reports to them every month. I need to know how to communicate correctly and assertively, but professionally. So I think it's there's quite a lot that you can learn about and focus on as you're going through, and you're learning at the same time. But I think clinical experience with my career is an absolute must, definitely. And in fact, here in the UAE, and particularly in Dubai with the DHA, the Dubai Health Authority, excuse me, you can't become registered until you've had 2 years of experience clinically in another country. So that's, a big part of the role as well.
Incredible. Definitely things that they don't teach you at school, but you kind of learn when you're on the job, would you say?
Absolutely. Yeah. I learned mostly on the job, to be very honest, because, as a nurse and a midwife, particularly when you're working on wards and, it's busy, you might be looking after, 10, 11 people at a time. You learn very fast, but, you learn by doing, and, you have that knowledge behind you, but then your colleagues also teach you. I've learned so much from my colleagues and, more experienced nurses or more experienced midwives. And even to this date, I'm the head midwife and I'm also a lactation consultant, but I liaise with my colleagues all the time. I'll say, okay, what do you think about this? Or what do you think about that? We help each other, and that we work as a team. And there's a saying, you're only as good as your team in nursing and midwifery, and it's very true, because we really rely on each other to give, optimal patient care.
I'm going to ask you something that definitely probably wouldn't have been a topic 2 years ago, but it is the topic all over the world. How has the pandemic shaped and evolved what you do?
Yeah, I mean, for us, because I work in a clinic, so we're not in a hospital with ICU or anything like that. We're in a polyclinic. During lockdown, of course, patients were a little bit more worried about coming in. We had to really quickly evolve our care in, when we're giving advice about, say, breastfeeding or baby care, we had to go online. Obviously, Zoom, I think that's one of the best things to come out of this pandemic is Zoom. So, or Microsoft Teams, we've been, liaising with others. All our meetings were online, and just kind of working out how we could give the best patient care. But of course, when you're weighing a baby, you can't do that over online, or you can't really help breastfeed, with breastfeeding online. So we had to completely change our layout of the clinic. So, we have an entrance specifically for babies and new families. Also, children having vaccinations, because it's still recommended that children and babies are vaccinated. And then we have another entrance for people who are unwell, with isolation rooms and things like that. So we had to really change a lot of our care. But the DHA, the Dubai Health Authority, they really helped us with guidelines. They were sending through guidelines every couple of days of what we needed to do. All our cleaning, we had to get in, obviously, masks. I know I'm not wearing a mask now, but I'm in a room by myself here, so as soon as I go out, I'll put my mask back on. But yeah, we adapted, and we adapted quickly, and we had to do that very quickly. So for me, I think that the main difference for us is our group antenatal classes. We obviously can't offer those, but we're still getting out that education to parents, which is fabulous, via Zoom or in person in a private class.
So many questions I can ask you. I'm going to narrow it down to one last question, which, when I think about what you do, and I think about the kind of work that you do, what comes to my mind is the feeling that you leave your patients and your clients with. You are working with them at probably the most vulnerable times of their lives, and also the most incredibly special time in their lives. What do you want anyone thinking about going into this career to remember? Because it's not just about the textbook cases. You deal with real people in really, really delicate times. What would you say young people should really be thinking about in their quality of character and their personality traits if they want to go into a career like this?
I think the word compassion comes to mind, and like you say, you meet so many different people in different circumstances. When I was working in London, I used to I worked on a birth centre, and I've looked after celebrities, I've looked after refugees, and everybody is treated the same. No matter where they're from, no matter what sort of socioeconomic background they're from, we treat everybody the same, and that's important. It's compassion, and that feeling. I'm just sort of thinking back to my labour ward days when I worked, and in the UK we are the lead professional with birth. So if, a woman is giving birth, we are looking after them, we do everything, and we only call a doctor in if there's a problem. And, doctors and midwives work very closely together. But that feeling of helping somebody through that journey, I remember driving home a couple of times thinking, oh my gosh, on a real high, thinking, I've really, really, really helped someone in that journey of their life. As you said, it's a journey, and I've been a part of that, and I've helped them with that. So, then that you're in the right job. You're in the right career. But even now, I'll have a family come in. They're really struggling with a newborn baby, and I'm a mum myself, so I've been there. I know exactly how I felt, and even though I'm a midwife and lactation consultant, I felt completely lost. I thought, oh my gosh, I know how to change a nappy, I know how to do the baby care, but I didn't realize the emotional side of it, how emotional it is when you're caring for a new baby, and how overwhelming it is. So for me to make a difference, and I think that's a big kind of part of it as well, not just compassion but making a difference, is really part of why I do what I do. I feel like I'm, it's a worthwhile career. I'm making a difference also for health. Mental health is a really big part of my job as well, supporting mental health for new families, particularly here in the UAE, as in there's a lot of support here, but a lot of people are away from their family and friends, their extended family. So that's where we come in to be a support network. So yeah, I think compassion, and I think with our wages, and I'm not complaining about my wage at all. I think I'm very happy, but maybe compared to other careers, but when we think about it during this pandemic, the medical field, we've actually, our jobs, hopefully for many people have been okay, because we're needed. We're a career that is really needed in these times. So that's another way to look at it, I guess.
Amazing. Thank you so much. I've learned so much. I've really enjoyed. I can ask you so many more questions, but we do have to bring it to an end. Drew, how can we find you if we are looking for a midwife, and where can we find the clinic?
Okay, so we actually have 4 branches of Healthbay. If anyone drives along Al Wasl Road, you'll see quite a lot of branches, but where I'm based is actually at the Verve Villas. So we're in between Sequim Street and Al Thania Street on Al Wasl Road, and we've got kind of big pillars. We've got a big 6-villa clinic, so that's where we're located. That's our base, and it's our Women's and Children's Centre. We have a website which is www.healthbayclinic.com. And we also have, we're obviously on Facebook and Instagram as well. So, anyone can call up. There's a toll-free number that you can call, and the call centre can put you through to me. So anyone that's maybe looking for a career in nursing or midwifery, I'm very, very happy to, answer any questions, or, direct, students in maybe, how I can help, or just, if someone's sort of looking, maybe they're not sure about a career, I can always, help them in that respect as well. So any questions are welcome.
Thank you. And that brings the end of another incredible conversation. Today we met with Dru Campbell, who is the head midwife and lactation consultant at Healthbay Polyclinic. Thank you everybody for watching. We'll see you at our next Desk Careers Digital Spotlight.